Welcome everyone, Dr. Mandell here. I want to show you a technique that you can do at home by opening up your drawer, pulling your sock out. Imagine a sock being able to correct problems in your neck. So if you are one who has suffered any kind of neck condition, this may do wonders for you. All neck problems revolve around lack of motion, lack of function. When there are areas within the spine, from poor posture, from accidents, injuries, chronic degeneration, the joints throughout the cervical region become limited. So if we can restore motion back into the joints, we're going to restore better function and ultimately better health. So looking at the cervical spine, we look at the discs which separate the vertebrae. That's cartilage. That keeps the vertebrae apart. That's where the nerves come out. If there is lack of mobility in these joints, anywhere along these vertebrae, particularly in the upper cervical spine, that can lead to headaches, pain over the head behind the eyes, dizziness, tinnitus, vertigo. Our objective is to get mobility into those joints. So we're going to use this sock to restore movement into these joints. And as we restore movement into these joints, you may hear audibles. You may hear pop, crack, click, which is okay, because we're going to do it very gently. So this is how we're going to do this technique. Preferably use a long sock, therefore you'll have more to grab. Put it in your lower part of your neck. If I work along the right side, I'm gently going to pull on that right hand going forward. I'm going to hold this steady on the left, and I'm just going to feel light motion along those joints. Now you notice I'm not pulling hard. And as I do that, I'm working my way up the spine, and we're just putting mobility into that area. Now when you get up to the top, you're working the atlas and the axis. Now watch what I do here. I want you to start looking up as you're up on top underneath the skull, and we're shifting on that lateral mass on that right atlas. Nice and gentle. We'll come back down to the left side, start on the left lower, and I pull with my left hand across, all the way around. Lightly, I'm feeling movement along those joints. And as I work up on the atlas, up on top, that lateral mass, I'm going to look up away just like this. And I'm working on that lateral mass on the left side. Now this upper area is very common that you'll experience potential problems over the head behind the eyes, dizziness, headaches, or even neck restriction. Now once we applied movement in there, what we want to do now is we want to stretch the muscles on both sides of the neck. Stretching the traps, levator scapula, the scalenus, the suboccipital region. So what we're going to do is take it underneath the skull. I'll turn around. The back of the skull under here. And what we're going to do is we're going to bring our chin to our chest, and we're going to take the sock and we're going to pull it down to the floor. You'll feel it right throughout the whole entire neck. You'll feel it in your upper back. Hold it there about 15-20 seconds. Then we'll turn our chin to the left and pull down to the left. You'll feel more in the right upper back, right neck area. Hold it there 15 seconds or so. Then bring your chin to the right side. Pull down, and you'll feel more on the left interscapular, left upper trap region, left upper back. Hold it there 15 seconds. You will be amazed that when you restore motion in this area, and you do it gently without forcing anything, you may hear audibles and pops, which is good because you're getting movement into the joint. Those are gases that are being released. But by restoring that movement, you'll notice right after, the neck's going to feel nice and light. It's going to feel as if you have much more range of motion. That means you made a positive change. I hope this helps you significantly. Do this technique periodically, a few times a day. Within a few days, you should see great results. I ask you to share this on your social media so we can help others worldwide. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.